Here is a small experiment done by my daughter about the bioelectricity. Before that, I want to tell you, our heart, very simple and most popular. Our heart takes one electric impulse to contract. Without electrical impulse, it will not contract. And if this electric impulse supply is not proper, the person has to go for a pacemaker. So, not only that, what I am thinking, what my body movements are there, what I am working on my next slide, what I am working on, when to finish this lecture, is all information is carried through electric impulse called bioelectricity. And you all know that when a current passes through the wire, it will always create an electromagnetic field around it. So if you want to check the current, the electrician will put his instrument around the wire and he will know what is the current is getting passed through this wire. So remember, we have all the electric circuit, and that is why we have a very subtle, very mild electromagnetic field around each one of us. Here is an example or a document from the small experiment. These are 5 lemon, fully ripe. We have put copper and zinc plates. We have completed that circle with the piece of wires, and there is a bulb at one end. No electric supply. See what happens.
Copper wire, copper plate, zinc plate.
हिरवं लिंबू असेल तर
हिरवं लिंबू असेल तर जास्त इलेक्ट्रिसिटीचा फ्लो मिळेल.
Now, if we put off the light, you can see the bulb glows. In fact, our each cell has a power close to 70 millivolts. It generates the power. I am not going to go detail to how it generates and how the mitochondrial action takes place. But each cell generates this much of power, battery power, so that it can absorb the nutrition from the interstitial fluid into the cell, and it can throw the used up nutrient food out against the cell wall. And by chance, if this becomes 30 millivolt, then it cannot absorb the fresh food. And if you look at some such person, you immediately comment, "Kai battery down hai ka?" You are not looking fresh. Yes, because the energy production has come down. So this concept is very clear. Chakras, I like the word energy zones. In Western country, they have started saying chakra because of Indian knowledge, but they call this energy zones, and I believe this is the energy zones, because if we have one transformer around this area, and if that gets blown up, entire area's electricity goes off. And our chakras do control some organs. If they get imbalanced, the organs, functions of organs get affected, and we have labeled them as diseases. So primarily, we have to balance the chakra first. This is our Vedic concept. That if you have any issues with the abdominal organs, first think about the Nabhi chakra, how to stabilize that, how to balance that. And there are some Ayurvedic practitioners who beautifully takes with a doctor, त्यांचं नाभी चक्र न बदल शिफ्ट झालं होतं, मी ते सेंटरला आणलं and the patient gets okay.
मराठीत त्याला गाठ सरकणे म्हणतात.
असेल. So our knowledge of chakras are very important. There are 7 major chakras having their own study. Is a big study. I take this for one full day. But what the important things I want to convey to you, these 7 chakras, the lower chakra will have the lowest energy, the highest chakra, the crown chakra will have the highest frequency. Of course, these figures are not like this, complete figures. With the frequency meter, we can check that can be 156, 216 different figures. But the concept is the root chakra operates at very low level and crown chakra operates at high frequency. These chakras have all sides, front, back, right, left, up, down. That is why when we want to map the energy, chakra energy, we have to circulate that person in 360 degrees. These chakras do transmutation. Transmutation means transformation of iron into gold, because we do change their atomic structure. Our chakras also absorb energy and they convert into the energy which our body is demanding. So they do transmutation. The modern medicine has not studied chakras, so their investigations are more related to the physical organs, endocrine glands. But our rishis are very clever. They said no. All your endocrine gland is controlled by the chakras. In fact, all the body organs are controlled by the chakras. To give you few examples, if that 1.5-year child, you say, shh, he will urinate. Because the Scho chakra is activating the Muladhara chakra, root chakra. The root chakra is activating his bladder, and that is why he is passing the urine. In fact, there was very big experiment carried in Pune, where 25 people were having the blood pressure machine tied up to their forearms, and the word was Tho, 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 Vithala, Vithala, Vithala. After 20 minutes, the blood pressure started dropping down, because the Tho and Tho word is for the heart chakra. So this ancient knowledge is now getting bright days. People are working on it, and I want you to take some clues from this information. I will show you one small clip about the chakras.
All beings have energy fields around them, commonly known as aura. The energy body absorbs prana from the environment and distributes this life force throughout the whole physical body. According to the energy body, there are different energy centers. In yoga system, these are called chakras. Chakras are whirling energy centers that control a particular organ or have a role in the proper functioning of that particular organ. these energy centers continuously absorb fresh energy from the surroundings. And expel used up and diseased energy back into the surroundings. When there's an accumulation of diseased energy in any of these energy centers, they start malfunctioning. And in the long run, the physical organ controlled by this energy center also gets affected. If by some means this diseased energy is removed from the affected energy center, it starts functioning at optimum level, and the corresponding physical organ starts functioning healthily again. That there is an intimate relationship between the visible physical body and the invisible energy body. What affects one affects the other, and vice versa. Hence, if the energy body is healthy, the physical body will be healthy. That is why it is extremely important to keep the energy body healthy.
Some of the clairvoyants who see the invisible body have reported by drawing that this is the balance chakra, these are the figures of imbalanced chakras. Of course, we do not have a technology to see the individual chakra, but we see their frequency, and that is why we see the colors. So, these are the only can be seen by very good clairvoyants, and scientists have discovered that diseases do alter behavior of chakras in terms of color, luminosity, rate, rhythm, size, form, and etc. We do have complete relationship. Because we want to interpret your Biofield scan, we need to study differently. So we do have the chakras and their relationship with the glands, and most of the books you have are full of with this knowledge. But in our Biofield scan, we see the root chakra, we see the sacral chakra, we see the solar chakra, we see the heart chakra, the throat chakra, and the broad chakra, and our crown chakra. These colors are of vital importance because there is a coding for particular frequency with the particular color, and that the interpretation is another study. But when we see the root chakra imbalance, we can correlate first with the physical body, because it is the chakra imbalance that is going to affect your organs. So moment you see the root chakra imbalance, the issues, immediately we can come to conclusion of this possibility of diseases or health issues. With sacral chakra, hyperacidity, colitis, appendicitis, infertility, dysmenorrhea, inguinal hernia, and sexuality issues. With solar chakra imbalance, pancreatitis, hyperacidity, ulcers, hepatitis, cirrhosis, gallbladder stones, splenic dysfunction, and then some mental and emotional issues. That is the advanced study. With the heart chakra, you can predict about the cardiac issues, the hypertension, pulmonary issues, smoking, pollution, breast diseases, and some of the mental imbalance. From Vishuddhi chakra, we can pick up information like pharyngitis, tonsillitis, thyroid issues, poor communications, and etc. From Broad chakra, we pick up migraine, sinusitis, poor concentration, fatal attachments. From Crown chakra, imbalance, cerebral issues like tumor, epilepsy, head injuries, meningitis. So, chakra study is very important, and there are a lot of books on chakras, but my orientation is how to pick up the information from the biofield scan, that is from the energy picture, and that is where we have to correlate the anatomy and Vedic knowledge together. So, the third component is of course meridians, study of 14 major meridians. What are meridians? They are the energy channels transporting life energy or prana throughout the body. If there are blockages in the free flow of life energy, it leads to lack of energy supply to certain areas of body parts. And meridians can be used to diagnosis and also for treating the health issues. If we can pick up the meridians, blockages in meridians, we know where to treat and we can get the benefit of that. So that is from the Acushastra. So this is the picture. We are constantly connected with the cosmic energy through this 72,000 meridians, and we get refreshed with the good sound sleep every night. We have a very false thinking that because we take 2 breakfasts and 2 meals, we are refreshing our body, and that is how we are fresh next day. No, it is the cosmic energy that refreshes us, and that is why if you have a poor sleep at night, you can remember your next day is not very fresh. So that is why the study of meridians is also very important. The Acushastra has given 14 meridians, and I have found the 14 names in Chak Samhita also. Our rishis were very great through the meditation. They have seen our invisible body precisely, and all our traditions, rituals, customs and beliefs, Saubhagyavatiche Alankar, they have all the science behind these points. In fact, our time when there was no homework done, there was only one punishment, sit-ups. But we do not lack the research orientation. I will show you in Western countries, in Paris, through the MRI, they have studied all the meridian points, and they found that this particular one is very useful to trigger our memory center, and that is how they have used this to treat the mental issues, the ADHD children, the ADD children.
Called Super Brain Yoga, an exercise intended to pump up cell and neuron activity in the brain. Alzheimer's patients, seniors looking to stave off memory loss, and kids in classrooms are among those who say doing it makes them smarter.
Now take your right hand, cross over the left side.
A medical doctor in Los Angeles prescribes an exercise.
Inhale going down, exhale coming up.
Not so his patients grow stronger, but so they become smarter.
He probably had a C average. I taught him these exercises, and by the next semester, he was a completely different kid. His grades had gone almost straight A's.
Take your left hand. A teacher in Malibu saw similar improvements in her learning disabled kids.
We have kids that have autism, kids that have Asperger's, all different needs.
They were assigned the movements.
Inhale, exhale.
Not to shape their muscles, but to sharpen their minds.
Yeah, we get smarter and smarter.
Good, Brandon. One child used to just stand there and not move. And now I'll ask him to do something, and he'll look at me, and he'll just take a moment, and then he'll do it.
A teacher, a doctor,
And then you take the right hand and place it over to the left earlobe.
a Yale neurobiologist,
Yes, I do it every day.
and an occupational therapist.
Inhale, blow up.
I think this might be the key to help unlock these children.
All
They have named it Super Brain Yoga, knowledge from our Vedic science. So we need to study from different aspects also. So all our rituals, utsavas and parampara are very important. There is a science behind that, and I do give one lecture on स्त्रियांचे आरोग्य व औराशास्त्र, सण संस्कार विधी परंपरा यामागचे विज्ञान, or even in Hindi also. So, where do we see these meridians in our biofield scan? If you have studied about it, then this is the heart meridian which we see here. This is the lung meridian which we are able to see here. I want to know whether the Ayurveda studies this Acushastra. No, it is not called normotherapy. It is called Acushastra is not covered in Ayurveda, right? The study of 14 meridians, their meridian points, acupressure is pressing the point. Acupuncture is entering the needle into the point. I think Ayurveda is not studying this. Okay, it is similar to, but not exactly. Okay, so these are very important aspects of the Biofield Science, that you need to study the meridians, because some of the accidental cases, if you press particular points, it will revive the patient easily. And if that is the same thing with Marma Chikitsa, then I am happy with it. Okay. So this is the pericardium which we see here. These meridians are not in the physical body. If you go on dissecting the physical body, you will not see these meridians. These are present only in the Sukshma Sharir, that is Pranamaya Kosh. So this is TW and all and all. Okay. So Biofield scan means electromagnetic field around us, energy zones, meridians, and Panchakosha, its relationship with the Panchakosha. For example, our root chakra is associated with the Annamaya Kosh. All our physical issues, even cancer, will affect the Muladhara chakra first. Our sacral and solar plexus, solar chakra is our Pranamaya Kosh. Our heart chakra is Manomaya Kosh. In future, maybe after 5 years, we will pick up the Karan Deha from this, which today we are able to see the Sukshma Deha. The next subtler is Karan Deha. We will pick up exclusively from the heart chakra. Our throat chakra and throat chakra is our Vijnanmaya Kosh, intellect body. And our Sahasrara chakra is our Anandamaya Kosh or bliss body. So we have entire information in the form of biofield scan of that person. Now, how to get the interpretation? Again we have to go to the Charak Samhita. All varieties of luster are constituted of Tej Bhutas. They are classified as 7 types, namely red, yellow, white, brown, green, pale, yellow, yellowish and black. Of them, which are smooth, bright, thin are healthy. Those others which are dyed, dirty, thick are unhealthy. That means all these big patches are chaya. All these thin line and bright colors, prabha. So simple. Our rishis have made it very simple. Then, how do we see them? Well, we have to go to the quantum physics, the Bio-photon theory. It says, the emission of Bio-photon is an expression of functional state of living organisms. Its measurement can be used to assess their health issues. During any physical, emotional, mental issue, a causative disturbance is always found in quality and quantity of Bio-photon emissions. If we are in meditation, the Bio-photon emission is less. But if you are hyperactive, Bio-photon emission is more. Cancer cells and healthy cells of the same type can be discriminated by typical differences in Bio-photon emissions. So Bio-photon emission is our capturing technique. And how do we do that? we need a special room. It should be a dark room like an X-ray room. No windows, no outer energy should come into that room. And the wall which we are using for the scanning purpose should not have any electric wire. The room should not have any furniture. It should not have a ceiling fan because it has got a magnet in it. So they will all produce their own energies. चर आणि अचर आपल्याला स्पंदन देतात असं आपले ऋषीमुनी सांगतात. So this is a special room where your health aura is 4 feet around you. So when you want to capture this, you have to go out of that. We capture the Bio-photon from 8 feet, so that we are concentrating and we are getting the actual information of that person. There is a camera which picks up the photo, the image, but you do not see the physical image because that software is trained to see the frequency of 320 to 390, which is the energy of Bio-photon, which is beyond our own sensory perception. And to see this image, to see this energy, we have to modify or create a software where we pick up this information in our own visible range, that is 7 colors. What is the process? You need 3 hours of fasting because whatever you have taken food in the stomach, the energy will be shown in the Nabi chakra. So we do not want that. So you should be fasting for 3 hours. Male patients stand by male technicians, female patients stand by female technicians only. 30 to 40 still images recorded with 360 energy assessment. Diagnostic information from your scan given immediately with the detailed debrief. You press the space bar and the picture is there on your screen. And immediately the information is available. Not like the modern investigation where you give blood today and you get the report after a few hours. Treatment options suggested based on patient's willingness, and the whole process is completed in 45 minutes. So we give appointment per patient for 1 hour only. And this is what we see in the scan. I have not repeated. These are the very safe for ladies patient also, because we do not see the physical body. We see the energy body only. This is called focal point, where your attention goes to the red spot. Now we have used the red color as an alert because we know red color is a stop color, a danger color. So we have coded that language properly. So what are the silent features of Biofield scan? Biofield scan is non-invasive, radiation-free, painless and cost-effective. You are standing under a full spectrum tube light and all information is gathered on the computer. Biofield scan provides immediate health assessment of your energy body, unlike medical tests which are available after a certain time span. It has a big contribution in preventive medicine. It has ability to detect disturbances in energy field prior to physical symptoms being manifested or detected, where medical science has not advanced to detect subtle energy level disturbances. So it is the future alert health status. It has ability to detect and highlight the areas of potential debility and warn the key person of any organization with immediate danger on health issues. It detects emotional disturbances directly affecting the productivity of the person, that is for the corporate world. It offers pre and post documentary evidences of alternative preventive curative remedies like homeopathy, Ayurveda, Panchakarma, Reiki, pranic healing, acupuncture science, flower therapy, and any other CAN therapies. So we give energy treatment, but we do get the post-energy treatment success also. So what are the scope of biofield scan? Medical science has studied only the physical body. For us, it is only an Annamaya Kosh. And their treatment regime is based on the visible aspect of physical body, and the treatment part is reactive and symptom based. We do not have to do that. All this information is only from Annamaya Kosh. And I would like to tell you that any disease has entered the physical body up to 20%, then only these medical tests come positive. Whereas, I will show you our scan, it has predicted the disease 6 months to 2 years in advance. It has not come onto the physical body at all. So, limitations of the current diagnostic tool, the modern medicine, sonography for the internal organs, X-ray for the bones, MRI PET scan for the small cell. In short, we can see the pathology in physical body. Accordingly, their treatment modalities are available. However, Ayurveda, as we discussed, we do have sufferings from our karmic issue, past life karmic issues, which are not detected by them, and then this is what happens. We lose some young, brilliant sportsman in spite of going for the regular annual medical checkup. They do suffer from cardiac arrest or kidney issues or liver issues. That means that information so far gathered was very much incomplete. Then what are the best advantage of the biofield scan? Painless, non-invasive, we have seen this. Describes not only present pathology but also past event and future issues in physical, psychological, emotional, spiritual dimensions. No possibility of any side effects. You don't have to take radioactive injections for the contrast MRI. So no injections. Inside out scanning methodology. All our X-rays, all our MRIs, the energy is thrown onto you and the information is picked up. Whereas biofield scanning is all your internal energy which is getting mapped up, which is getting detected. Predictive easily detects possible future health issues, point to root cause of health issue, enabling effective remedies. I showed you the case where there was overactive heart status. So we could treat them with the meditation practice. Very useful diagnostic tool for the mental and emotional issues seen more in ladies. In fact, the surrounding issues work on their chakra system. The chakras get imbalanced and they have the hormonal issues. And most of the time, they are not detected in modern medical science. No specialized and expensive infrastructure required. Research has established that emotions, belief and expectation release neurotransmitters such as histamine, serotonin, norepinephrine, steroid and peptides, which are capable of altering energy status at the cellular level. That means their Bio-photon emission is affected, and that is how we get the true picture of the person. Main advantage of Biofield scan is it can pick up minute energy disturbances before they have become full-blown physical diseases. If you take alkaline water, there was one product they wanted to develop, the alkaline water therapy. Moment he drank one glassful of alkaline water, I could show him the changes in the solar plexus. So it's beautiful research tool also. Vedic science predicts when we suffer from chronic, incurable and hereditary disorders as well as mental emotional problems, many times medical reports are normal because the root cause is not in physical body but in astral or invisible body. Our Vedic knowledge is perfect, quite advanced. Here is a case, a lady going with the marriage ceremony with lot of expenditure, sometimes beyond their limit. And if she comes back within 8 days back, no, I want divorce. I cannot live with this person. You can see the Manomay Kosh getting completely blocked. In fact, I have the scan of her parents also. They also received mental trauma. So all your energy status can be picked up here. So let us see some diagnostic cases. 10 minutes is okay? What we do here is we use the modern science and the Vedic knowledge together, the template from anatomical science and our own Biofield Science study, the Vedic study. So when we see the head area, it is a MRI for us. When we see the Anahat chakra, we get the cardiac issues. When we see the throat, we pick up information from many things, not only from the only thyroid or parathyroid, but his overall success in his life. Varicose veins, renal issues, we can pick up the information about the kidney functioning, prostate hernia, piles information, vitamin D deficiency, low immunity cancer because of the thymus gland, psychic attack, Wardha, Vardha, they do exist. Infertility issues, in spite of the medical reports being normal, the couple cannot conceive. The issue is with the sacral chakra and root chakra. Headache, insomnia, IBS, asthma, knee issues, pre-diabetic detection. There is one PhD student who has picked up this topic. So, some of the big figures in the industry, they undergo all the medical tests, but they have issues with the heart chakra. This is a case of depression. This person has spent 3 lakhs rupees in 3 years. Also has a MRI which also shows the circular red color, which we have also, our scan also shows the same thing. So our Rishi's Vijnana, our Rishi's intelligence was very great, and we have the similar things today to prove their teachings. Sciatica. We pick up the information outside and we can say, yes, you have this sciatica issues. No need to go for an expensive MRI. This is the case, September 2017. We picked up the information from the brain. This is the right brain. We are seeing the right side. And we suggested that whether your left side is, do you feel any weakness? No, nothing, no wrong with me. July 2018, he got the paralysis of the left side. And that time the MRI said, the MRI reports, here is the MRI reports, I have typed it again. The small area of blooming on GR is seen in a right temporal region with calcification seen in brain corresponds with the biofield scan. This is the MRI picked up that information after 6-7 months. This is another case of breast cancer. She went to the Tata hospital, gave the biopsy and came straight to our center. We picked up the information that the left breast is involved, right is slightly involved, and you can see the left axillary lymph nodes are also involved. After 2 days, Tata reported the same thing. There is one more case we are working on this. We have picked up the hemangioma of iliac crest on the bone, and CT guided biopsy also says the same thing. She is a lady, our course participants, where we do the scanning of that person, and I was worried about this extra energy. She said, yes doctor, I had a fall 4 months back. That issue is still there, they need to work on it. And look at this, very bad heart chakra, means very stressful life due to transfer, and she has a very highly disabled child also. So all your tension, all your lifestyle affects your body through the chakra system only. So all your modern lifestyle problems we pick up with the energy blockages through the chakra, meridians and the biofield, and we can predict about that person's health issue. Another lady having stressful life, we can pick up the information because this can correspond to your real brain tissue. Pre-diabetic cases, we can pick up and we can tell them go for the test HbA1c and get it confirmed, because they don't believe that they can have a pre-diabetic or a diabetes. No, my family nobody has the diabetes, so I will not have the diabetes. But when we pick up the right information and we ask them, it was 7 on the scale. 7 means much into the diabetes. One scan can reveal so much information from head to toe. Some of the disturbed children in the school, when we give lectures to the schools, these are the children who will not study themselves, but they will not allow somebody to study properly. They will use the abrasive language because of the poor throat chakra. See this, root chakra is affected, must be bedwetting at this age also. So these are the kind of disturbed children where they are usually sent to the psychiatric department, which is very wrong. We need to change their energy and not their brain functioning. The psychiatrists will always see that they think less. The brain is sort of given a low power, low thinking power. Okay? And they induce sleep also. This is another case having gone under medical report 17,000, worth 17,000. Issue was with the mental and emotional. Mental issue was with his business partner and emotional problem was with his wife. That is why these reports came normal. He is another course participant when I said, Baba, do you have any fall on this right side? Yes, doctor, long back, but I took one Combiflam and there is no pain now. I said, this will bother you sometime. You take treatment for this. probably acupuncture. That was the course on 28 May 2016. On October 27, 2016, that means after 5 months, he called me from the hospital. Doctor, my right leg is under traction. I said, I informed you much before. So all this predictive information. This is another case which I want to share with you. Daily 20 cigarettes and at night 2 beer bottles. His friend actually brought him to our center. Doctor, please convince him that these are not good habits. This guy was arguing with me, doctor, do you know I work for 18 hours per day. I don't feel tired at all. That means he is fully authorized to take 20 cigarettes and 2 beer bottles daily. I said, let us do the scan. What is the harm in there? Oh yes, I don't mind. When I showed him this thymus gland, that means his immunity is going down. When I showed him the chest meridian, that his lung energy is going down. When I showed him the acidity part, he got a shock of his life. He said, no, doctor, I realize it's a wrong thing to do. But, just think, if I would have advised him of one chest exercise, and if that chest X-ray reports no, everything is normal, no abnormal findings, I am sure he would have increased his 20 to 22 cigarettes next day. Because he has no fear. So this is the mapping of energy which predicts about the future health issues and everything about your bad habits. This is another study case. He is a monk with a lot of lipoma, and I was surprised that wherever there is a lipoma swelling, I have got the alerts there. See this. Exactly the same location. So, what body manifests is because of the energy body. I want to stress again and again. Few cases of cancer, the breast issues, where we have picked up a lot of information about particular breast, and there is good information available beforehand. These are some of the people who have come for regular checkup. Okay, doctor, you are talking so much, so let me get my scan, and we suggest some medical test. They come positive because we have to convince them that whatever we have found, you need to be serious about it. We have also got email from reputed hospitals that, doctor, you have cured the people where we have said, अभी नातेवाईकांना बोलून घ्या, अभी कोई इसको बचा नहीं सकते. And they have come to the conclusion that homeopathy, Ayurveda, meditation, music, acupuncture cases where modern medicine has been unable to prove its efficiency, we all wish to reproduce this happy conclusion but cannot, as we have taught to focus only on what we know. Very few of us pay attention to patient's total health, physical, emotional, social, preventive aspect of healthcare and positive well-being. So let us explore these therapeutic options which may be effective, safe, scientific and comprehensive to be integrated in our mainstream of practice. So we need to cure the patient holistically. What is the holistic healing? It is an attempt to influence the electrical, magnetic and subtle energy field around that person. If we can modify this from negative to positive, the health will be improved. We in our centers, we use these remedies plus Ayurveda and plus homeopathy. Whatever we find best and faster to cure, we use this. Let us see some of the cases. These remedies are effective on several diseases but have not been accepted by the people due to lack of evidence. They do not have pre and post images like MRI and like blood and X-rays. But today, Biofield Science provides before and after proof of positive energy changes. Acupuncture. See, this is the pain in the knee, in the left knee, and this is a slight pain in the right knee. 20 minutes of needling, you can see the right knee is devoid of any pain, and you can see the reduction of pain in the left knee. A visual proof. We don't have to ask the patient, "Abhi kam dukta hai kya?" No, we see the information here. Stubborn child, not listening to the parents, not listening to the teachers, not doing homework. We give the energy treatment, the child is relaxed, gets good sleep, good appetite, obedient, completes homework. Because I see the frequency, I see the color, it's not here, this color is not here, this color is not here. I have not taught you the color interpretation, but I see the change in frequency, though it must be the change in the mental attitude also. When I go to the south, they have a pyramid meditation, lot of pyramid meditation. So, and they were doing meditation for 1.5 hours. Yet they enrolled about 65 people for scanning. I said, you have lot of health issues in spite of the meditation and the pyramid. So I wanted to see this. So we have two ladies over here. One with they have all regular meditative practices. You can see the Ajna chakra, throat chakra is properly open, because for meditation, to go into the meditative state, we need this chakra open. And lot of throat chakra, and this is the heart chakra. Now, over a 15 minutes of time, you see it is still open. That means this person has really gone into the meditative state, because you can see the throat chakra is getting open, clean, and you can see the heart chakra is also getting clean. But there is another lady with the heart, the throat chakra open, the throat chakra blocked, and after 15-20 minutes, you see this is blocked. I said, you did not go into the meditation at all. You were dreaming something. She asked me, "Doctor, did you see my dream?" I said, no. Because I could see the heart chakra, the throat chakra needs to be open. Then only you can go into the meditative state. But if you have some thoughts over here, and if you get carried away with the thoughts, no meditative state. We can pick up this information from 8 feet. Okay, this is the knee joint problem. We have cleaned it with the alternative therapy. The knee pain has gone. This is another case. She was admitted in the hospital, and for her symptoms, she was taking 33 tablets per day. Because modern medicine is depending on the works on the symptoms. If you have one symptom, 1 or 2 tablets. If you have this symptom, another tablet. Similarly, she was taking 33 tablets, and at the end of 3 months, her system started failing. Doctor said, we have tried everything. She was brought home by the retired person, Said, I also exhausted my money. I know I'm going to lose my wife. Somehow he had some dental problem and he came to me next day to my clinic. I said, "Kya ho gaya?" He said, "Asasana." He said, "Can we send some healers to your house?" Yes, you can send. Within 3 weeks, this patient responded to the treatment. She was on the cot with no motion, no body movement when she was brought in from the hospital. She started working in the kitchen in 3 weeks. And we know after 2 months, they both went to the Pandharpur for yatra. That means energy treatment helps for the energy body. Accident case. For 15 years this did not heal at all in spite of the skin implant. Within 1 month, we can heal them with proper energy treatment. This the boy, 5-year-old, had a fracture of his left leg. It did not heal for 3 years. His mother would lift him from the house, and in the school she would dump this boy on the bench, and at end of the school she will pick up this boy and get him to the house. She had lost the faith on modern science because everything was tried. The fracture did not heal. So somehow she met me somewhere and said, "Doctor, I want to get the scan and treatment." 20 sessions of Reiki, crystal therapy, naturopathy, everything, and we could get that bone healed. What I am trying to tell you is, devise your own way after knowing the proper energy disturbances. I don't suggest or I don't emphasize that you work the way I work. You should find your own way and don't get disturbed by the modern medical information. You have much rich information in your books. Psoriasis. Patient take treatment for 2 years. This lady, just 24-year-old, could not go to the office because the whole cloth would become wet due to the secretion. Within 2 weeks, we could get her skin dry. See this person was unable to walk. Within 2 months, got completely rid of this. This is not from our center, it is from another Ayurved doctor from Vijayawada. He sent me the pictures that, "Doctor, after your lecture, this should be one of the good proof for you." So conclusion, last slide. Chakras and energy body can be seen with the Biofield scan. With the help of Vedic view of human body, the interpretation of the Biofield scan becomes reliable. Correlation between chakra panchakoshas and that between chakra and specific disorders in the body helps in reliable interpretation of Biofield scan. Scan describes not only present pathology but also predicts future issues in physical, psychological, emotional dimensions which are not yet visible on the body. Scan detects mental, emotional issues and spiritual progress where modern medical science fails to do so. Biofield scan points to root cause of health issue, enabling effective remedies. "25 years back, I was diagnosed as a case of hypertensive blood pressure, and I was taking medicine. 9 years before, I came in contact with Shivakrupananda Swami from Gujarat. He introduced me to the crown chakra meditation and my blood pressure became normal. I was told that this medicine will be for lifetime. I am not taking any medicine today. So, this is how I have tried to understand your subject. I can say I am not the student of Ayurveda, but you are the people can take this further. Look at the opportunities. In corporate world, in spite of normal reports in annual medical checkup, young key persons of the organization have suffered from heart, lung, kidney issues. There is also ideal energy body checkup for defense personnel. In spite of the rigorous daily exercise, our defense persons have experienced heart attack. That means we are not imaging there properly the information. The insurance sector relying on today's health status is risky. Your today's medical tests are telling about the physical body as on today. But if you provide the future health alerts, thereby making it easy to decide annual premium calculation more acceptable to both the parties. In US, these are working on this, insurance companies that no, I don't want your today's blood reports. I want your future health status. Because once the premium is fixed, it is fixed for a lifetime. Sectors like health education, Vedic human anatomy, healthcare and life sciences, holistic healing centers will derive maximum benefits from this technology. Low-cost, painless, radiation-free research tool for medical and clinical research program all over the world. And therefore, for primary healthcare centers, it should, in every town, this should be the first scanning, preventive scanning, before going to any expensive medical test. So what is suggested approach? Awareness of Biofield scan diagnostic methodology for all medical staffs, accreditation of selected staff members, taking consultation from IBRC for diagnosing difficult and complicated cases, research collaboration on selected topics, evaluating efficiency of any treatment procedures tie up with hospital as a regular diagnostic center and establishing fully functional Biofield scan center within hospital premises. So this is the 2-day workshop I take on this subject. Then I do take very advanced courses for 2 months where you are taught, everybody is not having a medical background, so we have to take their applied anatomy or clinical anatomy and our Biofield science. So this is the in thing now, the energy clinic. In next 3 to 5 years we will see lot of energy clinics. We do give lectures on this wherever we have 50 to 100 people. Yes, there is a book available with me. It's Marathi is Aha Mandal, Hindi is Aha Mandal. This book is costing 300 rupees, but we are ready to give you at 200 rupees also if you are interested. Thank you. Any questions?